One of the most common causes of a stroke in young people under the age of 60 is a hole in the heart. What I'm going to talk about in this video is what this hole is and how we can fix it. So, before you're born, you get your oxygen from your mother, and that goes through the heart through this flap, which is open. However, as soon as you take your first breath in, your lungs fill with oxygen, and you, of course, don't need the oxygen from your mother. The umbilical cord is cut, and after that, this flap usually closes. In about 25 or even 30% of people, that flap doesn't fully close, which is a type of hole in the heart we call a PFO or patent foramen ovale. As well as that issue where the flap doesn't close, there is another condition that can happen where that flap doesn't grow in the first place, which we call an ASD or atrial septal defect. Fortunately, for the vast majority of people, that doesn't cause any problem. So, in a small number of people, that can cause some serious conditions. So, the first thing is it can cause a stroke at a young age, and that is by far the most common problem for people who have a PFO. The stroke is caused because you get a small blood clot, which then goes through that hole and up to the brain. There are other people where that blood clot can go elsewhere and cause a heart attack or some other issue. The PFO can also be an issue for people who are professional divers. So there's a condition called the bends when they go very deep and then they come up and a bubble goes through that hole. And that also causes stroke-like symptoms. In some older patients, they have very low oxygen, usually when they're on intensive care. And if that can't be explained, it may be because of a PFO. So in the old days, the way of treating this was with open heart surgery. Fortunately, these days, the majority of people who have one of these holes in the heart, whether a PFO or ASD, that can be done through a keyhole procedure through a vein. This procedure, once you've got into the heart, can be as quick as 5 or 10 minutes, and it can be done either while you're awake or under general anesthetic. I have a model here, which is a 3D printed model of someone's heart, and you might be able to see here this small hole. And I'm now going to show you the procedure to close this. So we have a device, which you can see here. It's like two umbrellas that spring open when they go inside the body and they go on either side of the heart. And what we do to do this procedure is we have this heart, we put the first umbrella on one side of the heart, which you will see here opening, and then we bring it back, and on the other side of the heart, we open up the other umbrella, and that closes the hole. Once we're done with that, we just have to release it, and then the procedure is complete. So as you can see here, you got the umbrella device on both sides of the heart, and the hole is now sealed. Over the next 6 weeks, what happens is the body naturally grows a layer of skin over this device and seals it fully in place. And most people, if they're not already on blood thinners, you need to take some for about 6 weeks. This procedure is one of the safest procedures we do in cardiology. The risk is about 1 in 500 of a serious problem. And of course, most people do get a little bit of bruising at the top of their leg, but nothing more than that. Most people can go home the same day after the procedure. So, if you've had a stroke at a young age, I would strongly advise that you go and see a cardiologist if you haven't had this checked out, because you can have your PFO or ASD closed, and that can be done very easily and safely and will significantly reduce the risk of a further stroke. Thank you very much for watching this video.